Hi, welcome to Dr. Prakash Katakia's channel. I am Dr. Prakash Katakia, a family physician and an occupational health consultant. I have practiced for more than 35 years as a primary care physician, and my aim of starting this channel is to make you aware about the basics of certain diseases which are highly prevalent, how to tackle that, how to prevent it, and how to face that particular disease. So, for today's topic, I have taken as a fever the first aid. So, let's go directly to the topic. Now, the commonest cause of fever is infections. These infections are either bacterial or viruses or fungi or parasites. These organisms, bacteria, example of these are bacteria causing urinary tract infection, tuberculosis, throat infections because of streptococcus, typhoid, cholera. Viruses, common cold virus, polio, swine flu, dengue, HIV, and nowadays we are aware with new coronavirus. Then fungus. These are ringworm and dobies each, or which are infecting the central nervous system and lungs. And parasites like malaria and worms. So now what are the general symptoms of this infection? First is fever, then chills and rigor. How it occurs we'll definitely see in few more seconds. Body ache, headache, muscle pain, joint pain, and rashes. Other general symptoms are bleeding from orifices like bleeding from gum, bleeding from urinary tract, bleeding from anal canal, or skin ecchymotic patches. What we see sometimes a dark green patches, patches of hemorrhage below the skin. So these are known as ecchymotic patches. Another few symptoms are loss of appetite, nausea, vomiting, loose motions, and abdominal pain. Respiratory symptoms: running nose, sore throat, cough, and breathlessness. So now, what exactly is fever? And what is the normality of fever? In a normal human being, the normal temperature of the body is between 37 to 38 degrees centigrades or 98 to 99 degrees Fahrenheit. Generally, this is the normality. Now, how this fever occurs? Because of these infections, there is a regulatory center in our brain which acts as a thermostat. In a hypothalamus of a brain, we say this thermostat is set at higher temperature than the body. So what happens is the brain sends signal to other parts of the body to generate heat. So initially you will feel chills, that is shivering, and then the large movements of muscles, so that is rigors. So this is nothing but the production of heat in the body, and your temperature will go up. And once the temperature is at its peak, then everything will settle down. Now, what are the early options? A doctor is not available. In the middle of night, if you have fever, first is either medications. In medication, use only paracetamol, nothing else, because rest of the things like aspirin, ibuprofen, they are dangerous to the body. And one more important thing, because we are in habit of taking antibiotics left, right, and center. So no self antibiotics to be taken without consulting any doctor. And another option is tepid sponging. So why bringing down of the fever is important? Otherwise, it may cause high grade fever and complications of that. So once you take paracetamol, it may take half an hour to bring down the temperature. So in that meantime, you have to give basic tepid sponging. So what is that tepid sponging? So for that understanding tepid sponging, we have to understand the basic concepts of tepid sponging. First concept is heat flows faster from higher temperature to lower temperature area, and this we have learned in schools. Then heat loss is directly proportional to the surface area exposed, and evaporation of water is faster in dry than humid environment, and it is directly proportional to the number of air exchange or circulation. So in this we can say, in monsoon if you see, you keep your clothes to dry, it won't dry fast, but in summer it will dry faster. So this basic principle is there. Then what is the proper method of tepid sponging? First, because of tepid sponging, a person is going to lose water and salt. Because of that, he may end up in dehydration. As such, because of fever, the intake is reduced, and salt also is, along with sweating, it goes out. So hydrate well the patient, give him normal temperature water. Whenever you are doing tepid sponging, open the windows and doors in the room where patient is lying. Expose maximum surface area of the patient. That means a patient should be in a half pant or an underwear. Rest of the portion of the body should be exposed. Now use only tap water. No eau-de-cologne or no ice to be added to this water. What else it happens is, normally because of high temperature, the blood flow in the skin is very fast, because the blood vessels are dilated, that is more expanded. Now if you apply ice or cold water, these blood vessels will constrict and blood flow will be reduced. So heat exchange will take longer time and tepid sponging won't be effective. So only tap water to be used. Cover maximum area of body with wet towel or napkin. Not only forehead. We have a habit of putting a patti on our forehead. Not forehead. Full body has to be covered. Switch on the fans in the room so that circulation of air is taking place and it drains away the heat faster. And change this towel and napkin which you have used once it gets dry. Now what are the warning signals for fever? See, normally you should not worry about fever, because in a way it is a good sign. It suggests that your body capacity to fight the infection is there and it is manifested as fever. So in a fever, ideally it's a good thing, because high temperature of the body will kill those germs and bacteria. But it should not go beyond certain limit. So we have to be careful. So what are the warning signals when you should really be worried about whatever? Little fever also it's there. Like fever is high grade, more than 102, 103 persistently remaining. Altered sensorium, patient is drowsy, feeling sleepy, behavior changes are there. Or convulsions, seizures, fits, severe headache along with vomiting, breathlessness, or rashes over the body. And from the look of the patient, you can make out he is very toxic and he looks sick. Some you must have noticed in few viral infections, once you take some medicine, after that 3 to 4 hours you feel that absolutely you are normal. So that toxicity is not there. But same way, if bacterial infection patient like typhoid it is there, despite the fever is going down, patient looks toxic from the face. So you have to be vigilant in children whenever they have fever. Elderly population, more than 60 years of age, geriatric population, patients who are diabetics, immunocompromised, certain patients having cancer, taking chemo drugs which reduces their immunity, and other comorbidities like hypertension, heart problem, kidney problem, asthma. So these are the group of patients where you have to be extra vigilant whenever there is a fever. So how you can best approach is to prevent this fever. So how you can achieve this? Practice good hygiene. Maintain cough etiquette. Like nowadays it is stressed so much that even if you sneeze or cough, use your handkerchief, cover your mouth with elbow, then use filtered or boiled water. Avoid roadside food, and particularly in monsoon. Then maintenance of the surroundings. See, if we see malaria, basically it is a prevalent in an area where there is a stagnant good water, clean water, not dirty gutter water. And maximum breeding ground for malaria is perforated leads of the overhead tanks in the societies, where these malaria mosquitoes they breed. Then vector control. So this is a part of vector control. You can spray, like municipal people who are coming with controlling certain malaria and other disease with some sprays, and vaccination. Like other viruses in childhood, we give vaccinations like polio, triple, MMR, hepatitis. So these are the vaccination. So friends, this care you must exercise, and whenever you have fever, don't take any antibiotics without consulting doctor. And even when a doctor prescribes you antibiotic, complete the course of antibiotic, else it will end up in what we say resistance to that particular antibiotics, and you have to move to higher antibiotics. So in short, how to tackle a fever we have seen today, and next time when we come, we'll come with the basics of certain topic where we'll learn something. Okay, thank you. Have a good day.